Kids can suffer from the same maladies as adults. They can have traumatic brain injury, an anoxic incident. They can have status asthmaticus. In fact, kids are very vulnerable to respiratory problems. They can have strokes, just like an adult can, an aneurysm. They can have a metabolic problem, severe problems with their sugar. So it's important to keep in mind in sepsis and other things that they receive appropriate attention. Kids tend to do worse in many ways than adults do because a brain injury in a child affects their neural development, and so they tend to fall behind adults, and their profile will look different. But it is important to always, anytime you suspect a child has a brain injury, to get them assessed, to take them to the emergency department or to take them to their physician, and to call 911 or 000, 999, 112, whatever your emergency number is, wherever you are in the world, to get them assessed by a trained emergency physician or a neurologist to determine whether they have neurological injury. Because children, it may not be as visible or detectable because they may grow into their disabilities. They may look okay because oftentimes adults and people around them make up for their deficits, and the children around them are not developed enough yet to show that the person with the acquired brain injury has problems. Their parents are saying to all the kids, hey, make sure you share that. You don't keep it to yourself. Don't argue with your brother or sister all the time. But their brother and sister is willing to argue too because they're not mentally mature. But after 5 or 6 years, it's clear that this problem still hasn't changed. They still are this way. They still are acting like a 5 or 6-year-old. And that's due to the fact that their brain is not maturing, and that is due to the injury. So it is really important that when a child shows any neurological signs, changes in behavior, irritability beyond what would be normal, a parent knows what is normal for that kid. If they have sudden onset, if they report they hit their head, or if high temperatures, if their cries are unusual, if they are difficult to comfort, if they're difficult to rouse from sleep, if they are running a fever that is over 100.4 degrees Fahrenheit, you're talking about 40 degrees Celsius, 0.1. If they are repeatedly vomiting after a blow to the head, that's a big sign. If they're complaining of headaches that aren't getting any better, if they're more hostile or aggressive, if they are confused doing tasks they were able to do before, if they're complaining of a roaring or rushing sound in their head, if they seem to not respond to their name like they should, if you can find no source for their behaviors, if they're complaining of visual or auditory problems, if they're complaining of not being able to smell or smelling strange smells. Very important. Also, of course, it's important to listen to the teachers or to their other carers if they say something doesn't seem right, to get them to a physician to perform these evals. And of course, to keep up to date on any of the guidelines by whoever, whatever in your country provides information about concussions and about anoxia and cardiac problems and infectious diseases and things. Keep their vaccines up to date, make sure they see their physician regularly for developmental follow-ups, and just to keep an eye on things. And anytime they suffer a concussion or that they suffer, any kind of infection, to make sure you're watching their behaviors and watching how they interact to determine, maybe this is a visit to urgent care, the emergency department, whatever, or call and message their primary care physician.